Good afternoon everyone, I'm Abby Gonzalez and today I will be doing my return demonstrations for the procedures surgical scrubbing, donning of the sterile gown, and donning of the sterile gloves using the close gloving technique. Before performing the surgical hand scrubbing procedure, you must first check the following. Sync with water flow control with foot, leg, or infrared actuator element. Touching the levers can contaminate the hand, so if the water is controlled with the hand control levers, then the water is turned off by the circulating nurse. Next is the surgical brush. The surgical brush is used to scrub the arms and the hands to remove the microorganisms present. Beside it is the orange stick or the nail file. This is used to clean the area under the fingernails to reduce the chances of microorganisms remain under the nails. Next is the antiseptic solution. This is used to kill microorganisms in the arms and hands. Lastly is adequate knowledge. Adequate knowledge is needed because it is the most important strategy to reduce the risk of transmitting organisms from one person to another. Prepping for the scrubbing procedure. Enter the designated changing room. Remove all jewelry, necklaces, watches, bracelets because it carry microbes that can infect your patient. Fix and cover your hair. Use standard surgical hair cover and hood because hair and dandruff falls from your head without you noticing. Therefore, covering the head is essential for the patient's safety. Next is put on the surgical mask. This is to prevent bacteria, saliva, or mucus from contaminating your hands as you scrub. Next is put on prescribed clean scrub suit. Your suit should consist of a shirt and pants. Put on your shirt first. If you're wearing an undershirt, bra, or camisole, your shirt should cover it completely. Not even the collar or strap should emerge from the neckline of the scrub shirt. After your shirt is on, put on the scrub pants. Tuck your shirt tail into the waistband to prevent billowing or skin shedding into sterile areas. Be sure to wear clean scrub suit every time you scrub in. After doing the medical hand wash, we will now do the scrubbing procedure. Open the surgical brush. Check if it is embedded in an antiseptic solution. Embed the brush in an antiseptic solution if the brush is no longer embedded in it because this guarantees reduced multiplication or microorganisms in the brush. Next is to position yourself at the sink area. Make sure to keep considerable distance to keep your surgical attire dry and free from flushes from the sink. Make sure that no water splashes on it anytime during the scrubbing procedure because if you wet your attire, you must change clothes and start scrubbing all over again. We will now open the water. Regulate the flow to prevent splashes. If there is a temperature regulator, set the water at warm temperature. Antimicrobial soap works most efficiently in warm water, and avoid excessively hot water because it could lead to dry and irritated skin, while cold water should also be avoided because it keeps soap from lathering properly. Now, place your hands under the tap with the tips of your fingers towards the ceiling and elbows toward the bottom of the sink, and let the water run to moisten all the skin of fingers, hands, and forearms. The water should drain from fingers to the elbows. Keeping the hands above the elbows allows microorganisms to slide off the hands into the sink. Clean sublingual areas with a nail file. Hold the file in your dominant hand. Place the other hand under the water and allow the water to flow between your fingertip and fingernail as you remove the dirt with the file. Repeat this process with each finger on both hands. Cleaning this area under the fingernails helps in reducing the chances of microorganisms to remain under the nails, and then discard the nail file after. Soap up both hands and arms with antimicrobial soap using surgical brush. A good amount of soap is required to create lather for 3 to 5 minute scrub. With the surgical brush, begin to brush the area under the nails for at least 30 seconds per hand in circular stroke. Clean nails first because it is considered the cleanest part of the hand. Next is to scrub the fingers, divided into 4 quadrants, thumb first and outward motion, so that the germs will be away from the body. Make sure to scrub all areas of the fingers, including the web. This will help in reducing the chances of microorganisms around the fingers and the web. Next is to scrub the front, the side, and the back part of the hands in circular motion for at least 30 seconds. This will reduce the chances of microorganisms to remain in the front, back, and side part of the hands. Make sure to heat all areas of the hands. Now we will repeat the steps to the other hand to ensure that both hands are clean and free from microorganisms. Scrub the nails, the fingers, the front, the back, and the side part of the hand as well. After scrubbing both hands, we will now scrub the wrist. Then proceed to 2 inches above the elbow for 30 seconds and then do the same on the other arms. This will reduce the chances of microorganisms to remain in the arms, wrist, and elbows as well. When scrubbing the wrist, arms, and elbows, make sure that the portion of your sleeves are folded because it might get wet during the scrubbing and can cause contamination. Also, divide your arms in 3 parts and then scrub in circular motion. After scrubbing the arms and the elbows, discard the brush properly. Start rinsing your hands, then to arms. Keep your arms tilted upward and maintain your hands on an upright position. Rinsing removes transient bacteria from hands, and with the arms raised, it prevents contaminated soap and bacteria from soiling your hands. Let the water drip down to your elbows. No water must drip back to the hands that was just cleaned. Make sure not to let your hand or arms touch any part of the sink. If in case you accidentally touch any unclean area or any part of the sink, then you start scrubbing back again. Make sure that you will not use your cleaned hands when turning off the water faucet. Ask the circulating nurse to help you close it for you. Back away from the sink towards the operating room door using your back to enter. Keep an eye on your cleaned hands as you enter the operating room to avoid contaminating the hands. Now, pick up one hand towel from the top of the gown, pack, and step back from the table. Grasp the towel and open it fully. Do not allow the towel to touch any unsterile object or unsterile parts of your body. Hold your hands and arms above your elbow and keep your arms away from the body to avoid contamination. Holding one end of the towel with one hand, dry the fingers of the opposite hand using a blotting rotational motion. Move to the dry area of the towel and continue it in this manner down the forearm to the elbow. Repeat the process with the other hand using the end part of the towel. Don't go back over any areas you've already dried to avoid contamination. After drying, discard the towel on the floor. After doing the scrubbing procedure and drying of the hands with a sterile towel to prevent the spread of microorganisms and contamination, we will now do the toning of the sterile gown. The circulating nurse standing at the opposite side of the table will assist the scrub nurse in opening the wrapper of the sterile gown. The circulating nurse should only be touching the folds of the wrapper. The circulating nurse is considered unsterile, and doing this will avoid the scrub nurse from becoming unsterile. After the wrap was opened, the circulating nurse moves back away from the area. With one hand, pick up the entire folded gown from the wrapper by grasping the gown through all layers, being careful to touch only the inside top layer which is exposed. Touch only the top layer of the gown since it is considered contaminated, while the inner part is considered sterile, and touching it will make it contaminated. Once your hands are securely pinching the gown, hold the gown near the gown's neck and allow it to unfold. This will prevent the gown from touching the floor and unsterile objects. Step back from the shelf and allow the gown to drop. Make sure the gown does not touch any surrounding unsterile objects. This will give more space to avoid the gown touching other things that can make it contaminated. Grasp the inside shoulder seams and open the gown with the armholes facing you. That inside part that is in contact with you is considered unsterile, so avoid touching the outer part of the gown to prevent contamination. Carefully insert your arms partway into the gown, one at a time, keeping hands at shoulder level and away from the body. To maintain sterility of both the hands and the gown, and careful application also prevents contamination. Slide arms further into the gown sleeves, and when the fingertips are level with the proximal edge of the cuff, grasp the inside seam at the cuff hem using thumb and index finger. Be careful that no part of the hand protrudes from the sleeve cuff. Keeping the hands inside the sleeve cuff of the sterile gown prepares it for close gloving. A circulating nurse will fasten the gown behind you, positioning it over the shoulders by grasping the inside surface of the gown at the shoulder seam. The circulating nurse hands should only be in contact with the inside surface of the gown. Since the ties are located at the back of the gown, this will prevent the scrub nurse from contaminating the gown while securing it by not reaching behind to tie it. The circulating nurse then prepares to secure the gown at the neck and upper back. Gowns differ in how they are secured, but most with either ties, buttons, or Velcro tabs. By doing this, it prevents the contaminated surfaces at the back of the gown from coming in contact with the front of the gown. Before the final tie of the gown, the scrub nurse must first perform the sterile close gloving procedure. Performing the close gloving technique will avoid contaminating the outer gown since it is considered sterile. Now we will don the sterile gloves using close gloving technique. With the help of the circulating nurse, open the first package of the gloves, making sure not to touch the inside package. This is done in case there is no pre-opened package at the back table, so that the hands of the scrub nurse will remain sterile inside the sleeves of the gown, while the circulating nurse be sure not to touch the inner package to avoid contamination. Place the inner package of the gloves on top center area of the sterile drape or sterile wrap of the gown to avoid the inner package from getting contaminated. Now, place the right glove on the right gown sleeve, palm down, with the glove fingers pointing toward the shoulders. The palm of the hand inside the gown sleeve must be facing upward toward the palm of the glove. Gloving of the dominant hand first improves dexterity, and the right position of the glove for application over the cuffed hand keeps it sterile. While holding the glove's cuff edge with one hand, grasp the uppermost edge of the glove's cuff with opposite hand. Take care not to expose the bare fingers while doing this. Continuing to grasp the glove, stretch the cuff of the glove over the hand. Avoid touching the gloves with bare hands to avoid cross-contamination, and be careful not to tear the gloves, and avoid touching it with bare hands to avoid contamination. Using the opposite sleeve covered hand, grasp both the glove cuff and sleeve cuff seam and pull the glove into the hand. Pull any excessive amount of glove sleeve from underneath the cuff of the glove to ensure that no skin has touched the outside surface of the glove, thus preventing contamination. Using the hand that is now gloved, put on the second glove in the same manner. When gloving is completed, no part of the skin has touched the outside surface of the gloves. Check to make sure that each gown cuff is secured and covered completely by the cuff of the glove. Adjust the fingers as necessary so that they fit snugly. When putting the second glove, be careful not to contaminate the gloved hand. Ensure that no skin is exposed to avoid contamination, and adjust the gloves so that the gloves would fit snugly and not cause any discomfort. Once the sterile gloves are on, we will now do the final tie of the gown. There are different types of gowns, and another type of gown is with belt tabs. So the scrub person will take hold of the belt tab which is securing the belt ties, and then it will be handed to the circulating nurse. The belt tab prevents the tie from being contaminated when handing the tie to the circulating nurse. Another is, in the absence of belt tab, the scrub nurse may use a sterile forceps, and it will be the one handed to the circulating nurse. So in this case, the ties are in front, so you can give it directly to the circulating nurse, but you should be very careful not to touch each other to avoid contamination. On other types of gowns, the scrub nurse will secure the ties on the left side, but this one, it doesn't have a tie on the left side since it is tied on the back. This will ensure that the tie will not be loosened while the procedure is ongoing. So that is how you do the surgical scrubbing, sterile gowning, and close gloving procedures.